This is a Connections California presentation. Connections California is PHP's one of our newest programs, and it is an online resource and information hub for transition to adulthood and adult services. You are at 5 Medi-Cal eligibility categories for people with disabilities. This is the 4th in our September series on public benefits with Daniel Fortuño. So Daniel is the president and CEO of Benefits Education Center and has over 30 years of experience in training, counseling, and education in healthcare and benefits administration. As a national expert on disability benefits, he is highly skilled in interpreting public and private health and welfare benefits programs. Mr. Fortuño has worked in 11 states across the country and has trained and counseled over 20,000 individuals and providers during his career. And he's a darn good teacher. So we're very lucky to have him. So thank you very much for coming. And as always, we appreciate any kind of financial support you can give us, because as I said, we'd love to keep bringing this free quality program to you. So with that, I'm going to stop sharing my screen and turn it over to Daniel. Thanks, Daniel.
Thank you. Give me just a moment. And do I have a full screen?
We are good to go.
Hold on, I've got to move this. I always know is okay. I've got our pictures in the middle of the screen. I don't know how to move that.
Your pictures. Oh, our pictures. Oh, just kind of maybe go up to a corner, an end of it, and try and drag them.
I apologize, people. For some reason. All right, I'm just going to operate with my picture in the middle of the screen.
We don't see your picture. If you go up to a corner and try and grab it and bring it across, but if not, you can just look at yourself for the whole thing.
It's not grabbing. Anytime I try to grab, it starts the slides.
It's the universe telling you that it wants you to see yourself.
You know what?
Tonight.
I'm going to go with it.
All right,
I'll make lemonade.
There we go.
Welcome to 5 Types of Medi-Cal. As I tell people always, benefits are very much like a dysfunctional family. They do not make any common sense. They never have, never will. They're based on laws that are made by lawmakers that mean well, but often create programs that are very illogical. And then as the laws change, they continue to become even more illogical. So we do not logically try to understand this. What we try to do is understand these are the rules, this is how it works, and then we are able to utilize the programs in the way that they were intended. Okay, Medi-Cal for people with disabilities. We're going to be going over SSI based. We'll be going over age disabled federal poverty level, share of cost Medi-Cal, the breast and cervical cancer program, and my favorite, the California 250% working disabled program. So basically what Medi-Cal is, it's a form of health coverage. In other states, it's called Medicaid. Some states like Massachusetts, it's called Mass Health. In California, we call it Medi-Cal. So if you ever hear somebody talking about Medicaid, they're either misnaming, if you would, the California program, or in most cases referring to a program in other states. It provides health coverage. There are limitations in that not all providers take Medi-Cal. So, you need to be aware of that. That's why I'll have individuals, and I'll be talking a little bit more about that, that if they're able to maintain private health coverage in addition to Medi-Cal, they're in a better place for being able to access a greater group of providers. There is a residency requirement. I'm not going to get into the details of that. And also you have to have proof of citizenship. I'm not going to be getting into those details very much. I'm focusing more on the program, but I want you to be aware that those exist. And integration, as I mentioned before, if an individual does have private health insurance, that private health insurance will be primary and Medi-Cal is secondary. You can have both. The benefits or your costs are less. So let's get into the financial definitions, eligibility definitions, and how Medi-Cal looks at income. There is unearned income. When they look at unearned income, such as income from disability, such as Social Security disability insurance, or any other income that you get that you do not do work activity for, they look at it fully. It's dollar for dollar whenever they look at it in their financial eligibility. Earned income is looked at completely different. They do what's called a countable income calculation. So when they consider an individual's earned income from a job, wages, they do the countable income calculation to determine how much of that income they're actually going to look at. So let's take a quick look at what the countable income calculation is. They look at an individual's monthly earned income that's gross before taxes. They subtract $20, 65, and then the remainder is divided by 2, and that amount is considered to be countable earned income. So, oh, I forgot I had a fancy little thing here. Sorry. I get a little ahead of myself. Here we go. Let's go ahead and give you an example. Let's say we have an individual that makes $1,525 a month in earned income. That's gross monthly income. We're not looking at annual. We're not looking at what you take home. We're looking at before deductions. They always look at it before deductions. We subtract 20, we subtract 65, we come up with 1440, and we divide that by 2, and we have the net monthly countable earned income is $720. So even though in this example, the individual is earning gross monthly income of $1,525, when Medi-Cal looks at their income for qualifications, they're only going to consider $720. As I get into the programs, you'll see the importance of understanding that. So with that, let's go ahead and get into the SSI program when it comes to SSI-based Medi-Cal. So the medical eligibilities for SSI-based, you need to meet Social Security's definition of disability. You need to meet SSI's financial income and resources. So if you are defined as Social Security as disabled and you qualify for the SSI, which is one of the 2 programs typically that people would qualify if they have a disability over the age of 18 prior to 65 or normal retirement. That's the population I focus on. They are, if you're eligible for the income and meet the resource, you get Medi-Cal. And this is considered to be no-cost Medi-Cal, and they do pay retroactive benefits for up to 3 months. If it takes you a while to get on the program, they'll retroactively pay medical expenses 3 months prior. So basically, in principle, with the SSI program, you're eligible for $1 or more, and in the state of California, you automatically get Medi-Cal, and it also includes prescription coverage. That is not true in all states. Not all states link SSI and their Medicaid system, but in California, they do. So to go over as far as resources, what they look at, they're going to exempt a home, they're going to exempt a car, and assets up to $2,000 for an individual and $3,000 for a couple. And that's a rule from the 60s when that was quite a bit of money. That was enough money for a down payment on a house or to actually buy a car cash. They haven't changed the law. when it comes to the SSI program. So for SSI-based Medi-Cal, remember, we're going to talk about other types of Medi-Cal, you have to meet the restrictions, if you would, or the assets test for the SSI program. Now, the SSI program actually will allow you as an individual, if you do work activity and you do so much work activity that you're not eligible for a cash benefit under the SSI program, they'll allow you to continue it under a provision that's called 1619B. And the 1619B program we're going to go over shortly. And then if you have an individual who becomes eligible for the Disabled Adult Child Program, which talked about, I think, a week or 2 weeks ago, that's where an individual becomes eligible for benefits based on a parent's contribution if the income is so great that there's no more SSI under the Disabled Adult Child provisions under 1634C. The individual, regardless of how high that income goes, is able to maintain the Medi-Cal. So let's quickly go over the first, the 1619B. That requires that an individual have been eligible for SSI at least 1 month in the past year. They continue to meet the definition of disability requirements. They do not look at work activity when it comes to that. And they still need to meet the non-disability requirements, such as assets of at or below $2,000. And you need Medi-Cal in order to continue working. These are the provisions that an individual is able to continue to stay on SSI-based Medi-Cal, and even if they're not eligible for an SSI cash benefit. Gross monthly income must be below the state's 1619B maximum. And for the state of California, it's $56,758. This is an example where the program is constantly talking monthly income, monthly income, monthly income. Well, this is an SSI provision, and they talk about it annually. So they're looking at annual income. And then just to give you an example of what it might be in another state. Oh, my slide is missing that. I had previously provided the amount for the state of Nevada, and it's not showing, but okay. Now, the 1634C is in Charlie provision, and that's Medi-Cal under an 8 code that's called 6C is in Charlie for disabled adult child. This is when an individual loses SSI benefits due to SSDI, disabled adult child. That's when an individual is disabled between 18 prior to 22. Social Security has acknowledged that period of time via records, not just because there's an assumption of the disability. And then they grant a benefit where the individual is eligible for an amount of 50% on mom and dad's record if mom or dad are disabled or retire, and then at death 75%. The beauty of this is that this program, if it's done correctly, Social Security should put in the BIC code of C, and then if it's not done, or if it's done correctly, it should show up in the Medi-Cal system as an eligibility category of 6, C as in Charlie, for the disabled adult child. Unfortunately, it's not uncommon. It's not done right. It's not set up right. And then, you just have to do the extra energy to make sure that it's set up correctly. Now, often it's referred to as the Pickle Amendment, but it really, disabled adult child is the true name of how this continuing is going on. Now, the beauty also of this is, even though one house, one car, as of July of last year, they allow an individual to have resources up to $130,000. And starting for 195 for a couple, and starting as of next year, January, there are no asset limitations. Now we're talking about an individual in this or what I'm explaining now that is no longer on SSI, but they continue to keep the Medi-Cal through this provision, and they're actually able to have resources starting next year without any limitations. Now, please be aware, if an individual has resources that is earning them interest, that's unearned income, and that unearned income could interfere with the type of Medi-Cal they're on. Okay, so as I mentioned before, the disabled adult child, the individual has to have a Social Security approved disability after age 18 prior to 22. And it's not just a diagnosis. If you've attended my other trainings, you've heard me talk about Social Security's definition, and it really is about the clarity of the medical record, capturing the limitations of the individual is how Social Security looks at a disability. And it's never based on the doctor saying, well, I believe the person is disabled. That doesn't work. If they say that, they have to then qualify what are the limitations of that individual. How does that disability manifest itself to support that the individual is unable to do any type of work? The parent is considered to be eligible, as I mentioned, if they retire, they're disabled, or they pass away. And that's when a child would become eligible for a benefit that's equal to 50% of what the parent is eligible for of their normal retirement amount at disability or retirement, and at death, 75%. And it's important that the individual who's getting a benefit based on the parent make sure that they keep this eligibility category, which is the fancy name they give for the type of Medi-Cal, because you can have somebody that has a significant amount of income based on mom or dad's contributions that normally wouldn't qualify for Medi-Cal at no cost. So with that, I've just covered the SSI linked in two different ways that even though the SSI benefit has ended, an individual can still stay within that linkage. So now we're going to go over age disabled federal poverty level Medi-Cal. Medical definition is you have to still meet Social Security's definition of disability. And, you know, what occurs is if you're not on Social Security's definition of disability, they have a similar division that makes medical evaluations. Financial eligibility for an individual, they can have income up to $1,677. And for a couple, it's $2,268. So they're looking at a combination of either unearned income, and as I mentioned before, they look at it fully, or if there are earnings, they do the countable income calculation, and this is the maximum income that an individual for this calendar year is allowed. It is considered to be a no-cost Medi-Cal, and it also provides retroactive payments for up to 3 months. This program or eligibility category, one house, one car, and as I mentioned before, as of July, assets up to 130 for an individual, 195 for a couple, and as of next year, there are no asset limitations. So let's give you a quick example, because that oftentimes makes it easier for people to get the principle of how something works. So let's say we have Jane, who gets $1,200 a month from Social Security Disability, and let's say she has a job and she's earning $265. So the unearned income, they do allow a $20 any income disregard. And then the earned income, you do the countable income calculation. And since the $20 is being allowed with the unearned income, it's only 65 divided by 2. And so what occurs is we look at her income of 1180 plus 100, and the total combined income is $1,280. And it's important that you realize that, since it's below 1677, because the earnings are looked at through the countable income calculation, that she qualifies for age disabled federal poverty level. A benefits tip. Oftentimes there are people that'll just be off by a small amount. I literally have people have been off by less than $10. So in those cases, what we suggest is get a dental plan, get a vision plan, or other health coverage where you have a premium, and that premium then reduces your income. So let's give you an example. David's monthly income is $1,700 a month. He pays for a dental insurance premium, $54. And so what happens is we take $54, he gets his $20 any income deduction, the 54, and he's down to 1627, and he's going to qualify. Sorry, I went a little too quick there. He's going to qualify for age disabled federal poverty level by buying a small dental plan. And this is a way that an individual, can get on this particular type of Medi-Cal, which is a non-share of cost Medi-Cal, which I'll be talking about, the evil, as I call it, share of cost in a little bit. Which I'm headed there now. Share of cost Medi-Cal. Basically, it's Social Security's definition of disability. Financial eligibility. There is no income cap on this particular program, but what they do is they determine a share of cost, and they basically are going to charge you a monthly deductible to utilize the Medi-Cal program. And it also pays 3 months retroactively. So this particular type of Medi-Cal, also one house, one car, and as of, the 130 and starting next year, no assets. So let's give you, or let's explain how the share of costs works. They allow an individual, and the term of art is a maintenance need level of $600. There was a time where that was enough money to live on, but the law hasn't been rewritten, and this is how this particular type of Medi-Cal works. The income above the share of cost amount, similar in a principle to a monthly deductible, is the amount the individual is responsible for before Medi-Cal pays for anything. So let's give you a quick example. Mark has SSDI income of $1,800 per month, and he currently has no other income, but he dropped his employer health coverage and now has to apply for Medi-Cal. So we look at 1,800 minus 20, and then he's allowed his maintenance need level. Now for him to use Medi-Cal, the amount that he's responsible for, the name is share of cost, is $1,180 before Medi-Cal pays for anything. We'll be talking about later a way that a solution that we can give him that's going to assist. The Breast and Cervical Cancer Treatment Program is an excellent program. Medical eligibility, a diagnosis of breast or cervical cancer. Financial eligibility allows an individual to be as high as up to 200% of the federal poverty level. It's no cost Medi-Cal and will also pay retroactively 3 months. They allow one house, one car, the same assets that I've gone over before. Now, let's talk about my favorite Medi-Cal, the California Working Disabled Program, and you'll see how it is beneficial in many cases for individuals. So what it does is allows working disabled individuals to be eligible for Medi-Cal by paying a monthly premium. And the premiums are relatively low, and they actually have been suspended. Which is a positive thing. Medical eligibility, Social Security's definition of disability, financial income, your countable income. Remember that term? Countable income has to be up to 200 or can be up to 250% of the federal poverty level. Now, it was premium based. It used to have small premiums as little as $20 to around 200, but since COVID, it's been deferred. And I don't know if it'll come back. That's why I still talk about the premium, just in case at some point they decide to change the law and re-implement the premiums. It does cover retroactively for 3 months. One house, one car, up to 130,000 for an individual, 195 for a couple, and as of next year, no asset limitations. Now, with this particular program, this used to be a bigger issue than it's going to be starting next year, but resources like a retirement and IRA do not count for this particular program. So it was really beneficial before they changed the rules with Medi-Cal allowing individuals to have higher resources and no more limitations on resources starting last year or next year, excuse me, that, they didn't count retirement funds like IRAs. Now it's not as big of a deal. They say for this particular program, you have to have countable income less than 200% of the federal poverty level. The good news is disability income is completely disregarded. So if you're on state disability, Social Security disability insurance, you can be on workers' comp, you could even have private disability benefits. They're going to disregard it when they're looking at 250% of the federal poverty level. There, I went too fast and missed my little fancy highlighter. Now, the beauty of this program, that an income can be as high for an individual from wages as $6,160 a month, because after the countable income, 250% of the federal monthly poverty level is as high as $3,037.50. So this is after the countable income calculation. Now, the application, you can go online, Benefits Cal or Covered California. Just be aware that this program used to have specific workers that administered it, and sometimes the workers that are in the process of administering it do not know the program that well. So sometimes you have to advocate to make sure that they put you in the correct aid code. And the aid code for this particular program is 6G, as in George. Now, I'll give you an example. Somebody's making as high as $1,200 annually. We don't even care what they get from disability income. They do the $65 earned income exclusion, the $20 general income exclusion. They allow you to deduct any impairment-related work expenses, and an impairment-related work expenses, not the IRS version, but it's got to be related to your disability and the fact that you're doing work activity. In this example, my subtotal is $915, and that's divided by 2. And this individual in this example has total countable income that is considered of $457.50, significantly lower than the maximum, and they are going to qualify. As of July 1st, 2022, they did eliminate the premiums in the middle of COVID. And again, I don't know if that's going to stay in place. We could hope it does, but right now, the premiums do not exist. But if they start up again, here's an example of what they used to be like. An individual with countable income between $1 and $60. And that last example, that individual's countable income was below 600, and the premium used to be as low as $20 a month. And as you see, it can be as high as 2,000, but that's when an individual has significant earnings. Now, let's go ahead and talk about Mark, who had $1,800 of SSDI income, and his share of costs was $1,180. So here's the calculation that explains, again, the share of cost issue that he was dealing with. Now let's give Mark a job. If we give Mark a job and we work on putting him in, transitioning him to the working disabled program, what's going to occur is they're now going to disregard that $1,800 a month. They're going to look at his income, earned income of 300, subtotal divided by 2. He only has countable income that they're going to look at for the California Working Disabled Program as of $107.50. The beauty of this is even in the past, and you see I put past premium, was only as low as $20 a month as opposed to $1,100. So it's worth it for him to take a small job. I've seen people take jobs making $20 a month to get out of share of cost Medi-Cal, and it works in their favor. Now, Medi-Cal does have a health insurance premium payment program, and the philosophy of this program is if you have private health insurance, they're going to cover the bulk of the cost, and it's cheaper for us to pay the premium than it is for us to pay the part that the health insurance, and we'll pay the premium in addition to covering the co-pays and deductibles for that individual. The eligibility, you have to be eligible for Medi-Cal. You have to have private health coverage that covers your high-cost medical condition. Now, there are some challenges with this particular program. You cannot be part or enrolled in managed care Medi-Cal. So you have to get disenrolled from managed care and be in fee for service. That can be a challenge, but can be done. And the whole purpose is so that you're on fee for service, you can enroll in Medi-Cal HIP and have your private health insurance premiums paid. You cannot be part of what's called a pre-payer county health plans. We don't see those very much. You cannot be Medicare eligible. You cannot be on TRICARE, formerly known as Campus, or on the Mr. Mitt program. Some of these coverages existed prior to the ACA, nicknamed Obamacare, which now it's easier to get onto Medi-Cal and or private health insurance. So we don't see these as much. The big issue here is the Medi-Cal managed care. So integration, private health coverage is primary and Medi-Cal is secondary. Here's where you do the application, and here's their email on their fax number. If you're going to mail it in, here's the third-party liability and recovery division. That's a particular group of people that deal with this. And with that, I want to say thank you, and I'm open for questions.